In just a moment, making friends might help you avoid cardiovascular disease. Coronary heart disease, cardiovascular disease, is the biggest killer in Australia. It contributes to more than 20% of deaths in this country. But there are ways in which we can reduce our risk of contracting it that don't involve necessarily medication or even exercise, and you might be doing it already. It's about having a partner or a group of friends, or playing chess or cards, or having an active social life. That's what Monash University has found in a groundbreaking study just published by the British Medical Journal of Epidemiology and Community Health. Dr. Rosanne Freak-Poli is from the Monash University School of Clinical Sciences and School of Public Health and Preventative Medicine. Doctor, good afternoon.
Good afternoon. Thanks for having me.
Why are social connections so important to preventing cardiovascular disease?
Well, what we've found from talking to over 10,000 healthy Australians who were aged 70 plus, we just looked at 25 socialising variables and then looked at their health, cardiovascular health, 6 years later. What we found was that being in a marital relationship or partnered relationship lowered their risk for both men and women. However, when you look at other activities, it was there's gender differences. So for females, for women, having at least 3 friends whom they could comfortably discuss private matters with lowered their risk of cardiovascular disease by 30%. For men, it was, again, the magic number of 3 relatives who they could discuss private matters with or felt close to enough to rely on for help.
So that's the key. It may not be the number, it could be 2, could be 4, I don't know, but the fact that people are willing to talk to someone and say, hey, I need help, or I'm not feeling well, and the friend hopefully would say, well, go to your doctor, or go and to speak to a specialist, or go to an expert. It's the advice that they are giving, the support. Is that what the problem is? The fact that you can perhaps, if you're not feeling well, you get that support to seek medical intervention before you perhaps suffer from cardiovascular disease.
Exactly. It could be that way. There's other avenues, for instance, that people who are socialising are more likely to have healthy behaviours that affect their cardiovascular health. So that could be they're more likely to undertake physical activity or eat well. And, of course, we know those are already risk factors for cardiovascular disease. The other thing is that we as humans are social animals, meaning that we would like, looking at our historical context and where we came evolutionarily, we survived in groups of people, and maybe there is something there around the fact that we need to be in contact with people, talking to people, that is beneficial for our health beyond what they're providing us as in support or lifestyle factors.
Why 3? Why is that the key number?
We used AI technology to help us assess the response options. So we have a number of options that people could answer these questions with. Now, to do that manually, myself, would take a long time. But what my colleague did at Jimile Tashale is he used AI technology to assess which one was the best cutoff for cardiovascular health. And we found 3 was the magic number for both men and women. And I think it really shows that you don't need a lot of friends. You just need a few friends or relatives that are there to support you.
So it's interesting also the differences between men and women and how they socialise. With women, it is the socialising that's important. With men, they like to have a bit of competition. You talked about chess and cards and things like that, or maybe going to a quiz night or watching their favourite team play or playing some sort of sport themselves. With men, it is competitive. Is that the case?
I'm not sure if it's about competition. I just think that we found a broader range of activities that could be beneficial to cardiovascular health. As you mentioned, activities like playing cards or chess, going to sports events, even if it's for entertainment or social events like theatre and cinema, were beneficial to men. For both men and women, babysitting or childminding in the past year was beneficial to cardiovascular health. And then additional ones for men included caring for another adult in the last year. So there is a wide range of activities that people can do to reduce their cardiovascular health, but are not necessarily the traditional lifestyle factors that like exercise and diet that we're used to.
That's not to say that you can not exercise and eat as much as you like as long as you have lots of friends. That is not it.
That is not it. That's definitely the message, is that we need to make sure that we quit smoking or maintain a smoke-free environment, that we reduce our blood pressure for cardiovascular disease is very important, or monitor our blood pressure. And then on top of that, there are a range of cardiovascular disease risk factors that you can discuss with your GP through a heart health check if you're interested in learning more. Okay,
so you looked at people over the age of 70. At what stage do the advantages of having this social connection, do they start to kick in? Is it immediately at 70? Is it older than that? Well, what's the age? Well, how important is the age?
So the people in our study were aged at least 70 years old. We did have some people that were in their 80s when they first came to our study. What we were finding is that the benefits are instantly there for well-being. We know that from prior literature. So there is a great benefit to your quality of life and your well-being for having friendships. Then if you look more long-term, what you find is we follow them for 6 years in this case to see the benefits, but we could see the benefits after a year or two.
Right. You also say in your report, Dr. Rosanne Freak-Poli is our guest from Monash University, that people tend to change their social groups every 7 years. How does that happen?
What we find is that as we go through life, we make choices about, for instance, education, where we go to high school, if we go on to university or a TAFE or another educational facility, or if we go into the workplace, if we move locations. And we will find, if you look at people's lives in general, every 7 years, they have different friendship groups, which means that we need to make making friends actively throughout our life course. It's not just something that we need to do as we get older. And engaging in local community events, for instance, neighbourhood house or the council events of where you live, could provide benefits, because then you get connected with your local community.
Yeah. So if you're looking at people over the age of 70 or 70 and above, then they are mostly people who've already retired, with a few exceptions, obviously. How important is retirement in, preventing cardiovascular disease, or at least reducing the risk of it? That perhaps you have more time to yourself, you have more time to spend with other people, but at the same time you lose that connection that you have with the people at work.
That's right. So retirement is a very interesting topic in itself. We know that there's a group of people that love retiring. They may be more financially secure, for instance. They may be able to engage in hobbies that they weren't able to before, which means they potentially have maintained their health. Then there's a group of people that really see the part of their identity as their work, and removing that social support from work is more of a detriment. So that's where we see things like men's sheds coming in really handy, particularly for men who have been in the workforce, to engage and find friends in their third age, as they say.
We'll get to that again in just a moment with two people who are doing it in Penrith. Just finally then, if you're not in this position, if you are not married, or perhaps you have a partner who's died, a husband or wife who's died, or perhaps you don't have three really good friends, what can you do?
There are a range of options for you to find. So the public libraries in your local area, neighbourhood houses, local council events usually have a calendar on their website. There's the Friend Line, which is friendline.org.au. You can also, if you're interested in running or walking, go to a park run or a Heart Foundation walking group. There is a registry through Ending Loneliness Together, and that you can find on the internet. There's also book clubs and choirs, as well as men's sheds. These are all national resources.
Do you think doctors should prescribe friendships these days?
I believe that there is an option to improve our physical health through GPs addressing more than just their physical risk factors for cardiovascular disease, and this is called social prescribing. So one option is for doctors currently in the UK are doing this. It's a funded program where doctors prescribe a link worker who can talk to an individual and work out what it is that would interest them and benefit their life now and in the future. And through this, we can see great advantages. There's a lot of research already done to show that that's cost effective as well as good for your health.
All right. Dr. Rosanne Freak-Poli, thank you so much for your time and for your work.
Thank you.
Thank you. There you go. Get more friends and hopefully you can prevent cardiovascular disease. Get some friends, get some exercise at the same time, maybe as a member of the Penrith Men's Walk and Talk. This is Drive on ABC Radio Sydney with Rod Quinn.